Have you ever wondered why depression seems to affect women more than men? It's a curious fact, isn't it? Women are twice as likely to experience depression compared to men, but why? It's not just a case of the blues or a fleeting mood swing. No, depression is a serious mental health issue that demands our attention. By understanding its signs and symptoms, we can better support those who are silently suffering. Remember, depression can be different for everyone, especially for women. Identifying depression in women can be complicated because symptoms vary greatly. It's not a one-size-fits-all situation, and the signs can be as diverse as the individuals experiencing them. One of the foremost indicators is persistent sadness. This isn't just about feeling blue for a day or two, but a deep-seated gloom that just doesn't seem to lift. It's a sadness that's there, even when there's no apparent reason for it. Next, there's a significant loss of interest or pleasure in activities that were once enjoyed. This could include hobbies, social events, or even simple everyday tasks. This disinterest is more than just feeling bored or unmotivated. It's a profound lack of joy that's hard to shake off. Changes in appetite or weight can also signal depression. Some women may find they're eating more than usual, while others may lose their appetite altogether. This can result in noticeable weight gain or loss. Sleep disturbances, such as insomnia or oversleeping, are another common symptom. Likewise, slowed thinking or movement, fatigue, and difficulty concentrating can all be signs of depression. Feelings of worthlessness or guilt, often about things that wouldn't normally cause such feelings, can also be indicative. And in severe cases, there may be recurring thoughts of death or suicide. However, it's important to note that these symptoms must be present for at least 2 weeks to be considered depression. These signs and symptoms are often overlooked or misunderstood, making it crucial for us to better understand them. Depression in women can also present unique symptoms. It's not uncommon for women to experience atypical depression. This form of depression is a bit of an enigma, as those affected can temporarily feel better in response to positive events. It's a fleeting relief, but it's a characteristic that tends to be more common in women. Another symptom more prevalent in women is an increased appetite, which can often lead to weight gain. This isn't just about indulging in comfort food, but a marked increase that's out of the ordinary. Oversleeping or hypersomnia is another symptom that women with depression might experience more than men. Women with depression are also more likely to display symptoms of anxiety. They may also have somatic complaints, such as persistent headaches or back pain, and an increased sensitivity to rejection. These symptoms may not be the textbook definition of depression we're used to hearing about, but they are every bit as significant. Recognizing these unique symptoms can help in identifying depression in women. Depression in women can be complex, but recognizing the signs and symptoms is a crucial first step. Over the past few minutes, we've explored these signs and symptoms ranging from feelings of hopelessness and guilt to physical discomforts like headaches or stomach issues. We've also highlighted some unique symptoms women might experience, such as increased sensitivity to rejection or a pronounced feeling of worthlessness. Remember, it's vital to understand that these symptoms must persist for at least 2 weeks to be considered as depression. It's not just about having a bad day or week, but a prolonged period of emotional, mental, and sometimes physical distress that interferes with daily life. Being aware of these signs and symptoms, paired with an understanding of their significance, is the key to opening dialogues, starting treatments, and ultimately, supporting the women in our lives who may be silently suffering. By understanding these symptoms, we can better support the women in our lives who may be silently suffering.